In the particular case of Latinos, we have one of the groups in America that has least access to health insurance in the marketplace, the most undercovered, underserved, medically underserved community in the United States. And did healthcare reform, Brent, respond to some of those needs in a way that may get a different reaction to the attempt at repeal? Are Latinos going to say, hey, wait a minute, we need some of the stuff that's in that bill?
Well, absolutely. It addressed some of the needs, but very clearly, we had a campaign called Latinos United for Healthcare. There were some priority items that we were successful in getting in the bill, and then there were some that we did not, especially when it came to legal immigrants getting coverage. In many cases, they're cut out even if they're legal immigrants. And of course, if you're undocumented, you can't even participate in the exchange with your own money, which we think is a shame. We were successful in getting some additional dollars for Puerto Rico, which was really important to us because Puerto Rico hasn't been treated like other states, still isn't, but it's better than it was. So we got some measures, but one of the things we're going to be subtle in our response to some of these changes because some of the bill's components didn't really help the community as well as it could have. We'd like to see some changes in that as well. But one thing I wanted to mention is we've never really had a free market system in our healthcare coverage. The problem with when you go to the doctor,
not in the modern era, anyway.
Not in the modern era.
Once upon a time,
oh yes,
it was just all fee for services.
Right. But in the modern era, I mean, you go to the doctor's office, you don't even know what the prices are. They don't post them up on the bulletin board, so you can see what it's going to cost to get your, checkup or whatever this thing is. The free market doesn't work in healthcare. I would agree that if we wanted to try to help lower costs, we got to figure out how to get a way to have people shopping around for coverage, just like you do with a car. I mean, it sounds perhaps scary, but there has to be some competitive pressure in order to lower prices.
Tough to do with medical care, though, because we buy it in a way that's different from almost everything else we buy in life. You mentioned the example of a car, or a house, or clothing, or a restaurant meal. There's nothing that we buy the way we buy health care. Nobody would call a hospital and say, I have a tumor, and I'd like to see who your cheapest neurosurgeon is. Or I have a problem with a valve, so I want to find out who your cheapest heart surgeon is. And give me that guy. What we want is the most expensive heart surgeon, but for somebody else to pay for it, don't we, Tom?
Well, that's the thing. I mean, in a free market for healthcare, you'd have to have savings, you'd have to buy insurance. And by the way, when you talk about Latinos, in a free market for healthcare, health insurance would be a matter of contract, not tied to your job, not tied to your immigration status. No obstacles to buying it, no obstacles to insurance companies pricing it according to risk. So you have to have catastrophic coverage, you have to have savings, and you have to have a charity backdrop for people who truly cannot afford care. But I don't know that I see that healthcare is different fundamentally from anything else on a free market. And Brent says, free market doesn't work in healthcare. But what we have now is not a free market in healthcare. We have all this third-party payment system where you have to get your health insurance through your employer. No reason why we can't shop just like we do for a car. Now, you wouldn't go in and say, I want the cheapest brain surgeon, but people do routinely get second opinions and third opinions. And that's not just for the diagnosis. On a free market, it would also be, well, this surgery is, $30,000, and this is a great doctor. This surgery is $27,000, and the doctor's equivalent. Maybe I'll go for the cheaper one. So it's not just price.
Not just price, but it is hard to comparison shop in healthcare.
Well, it is now. You don't have any conception now of what it would be like on a free market. But there's no reason it wouldn't be like a grocery store. I mean, people don't, what's more important than food? But people don't say, we have to have a government-paid food service with government-run grocery stores and regulated prices and so forth. People somehow manage to figure out how to put food on the table every week, even though there's a dizzying array of items, thousands, tens of thousands of items in the grocery store. Somehow we manage to buy the ones that we want at the prices we're willing to pay. There's no reason healthcare in principle cannot be the same way.
But each time you eat, it's not a life or death decision. And when, I'm a mom, and when my child is gravely ill, I'm thinking of that decision in a non-market terms. I'm thinking of that in terms of who can do best by my kid, make my sure kid is safe and healthy, and I don't think of that. And the issue is most people don't think about it that way. And right now there's actually no employer mandate with this legislation. There's no employer mandate right now, and so people don't have to get health insurance. It's not a rule that they have to get health insurance through their employers. People can choose to purchase health insurance in the individual market. The fact is the individual market is a disaster for people. There's no protections for consumers. Prices are much higher. When individuals personally purchase health insurance, they are at the worst risk with insurance companies. They have the least power, and the reason that people come together to buy health insurance is they actually have more protections and more power vis-a-vis the insurance companies. So that's one of the reasons why I think there is, and a lot of people have interest from getting health insurance from the employers because they have more rights and protections. That's how the individual market kind of fails them.